Hello, everyone, and welcome to the Foundation for Opioid Response Efforts webinar this afternoon, which is an informational session about our latest request for proposals to build on our community-driven responses to OUD disorder and overdose mortality. This is a focus on capacity building grants for smaller community-based organizations. Our agenda today is to give you a brief overview of four and of this specific RFP, and then leave a lot of time for your questions. We always aim to take as many questions as we can during this session. Please get your questions ready, and you can begin to add them to the Q&A section of your Zoom screen. I'm Karen Scott. I can say that. I'm Karen Scott, President of the Foundation for Opioid Response Efforts. Next slide. Just quickly, the webinar, as always, is being recorded and will be available on our website shortly after the session ends, along with the slides that we're going to use this afternoon. And then, as I noted, please use the Q&A bottom at the bottom of your Zoom screen. That also allows you to upvote questions that might already be there if they're similar to the ones you have. So it'll help us in prioritizing the questions we aim to get to during the session. Next slide. Okay, for those of you who are new to FOR, just a little bit about our background. The Foundation for Opioid Response Efforts is a national private grant-making foundation focused specifically on addressing the opioid crisis. We set a vision in 2018 to inspire and accelerate action to end the opioid crisis, and to do that through convening and supporting partners, advancing patient-centered, evidence-based solutions to the crisis. We support work that has patients and people with lived experience at the center of the work, and promotes excellence in professional education, payer and provider strategies, policy initiatives, and public awareness. Next slide. Today, is there a way to move the just so that we can see the screen? To date, we've awarded 118 grants since March of 2020, and that is a total of the amount of grants awarded totals over $47.5 million. We are a national foundation, and so we take that mandate very seriously in terms of helping to support work in many different kinds of communities and geographies straight across the country. On our website, each of these dots links to more details about our current network of grantees. So we invite you to learn more about them on our website. But again, we do focus a lot on making sure that we create opportunities for connecting with organizations doing great work straight across the country, which is why these RFPs are so important to us. Next slide. Programmatically, we've focused our work to date in these main programmatic areas. We have a big focus on improving access to treatment for opioid use disorder, particularly for those populations at highest risk, such as people coming out of correctional settings, people in perinatal and postpartum populations, as well as rural and urban populations. We did some specific rapid response support during the early days of the COVID-19 pandemic, and then also have developed programs on our Innovation Challenge, which is really an opportunity to support different organizations coming together to work on some of the really long-standing problems, such as stigma data, that can often be barriers to accelerating this work. And we have a significant investment in our family and community-based prevention program, which is a focus more upstream opportunities to support children and families at high risk. including work that focuses on mitigating the impact of adverse childhood experiences. 2 years ago, as you'll hear, we launched our newest full grant program, which supports community-based organizations in building their capacity, so providing more flexible funds, and that's the focus of the discussion here today. We also earlier last year began to do a little bit more work in supporting fellowship and training programs to support early career professionals in healthcare as well as in law, to serve individuals and families impacted by the opioid crisis. In addition to our grant making, we do provide a lot of, we develop a lot of resources, webinars, issues, policy briefs that highlight the work of our grantees. And again, I invite you to go to our website to learn more about our grantees and make use of some of the resources we have there. Next slide. Right, so on to the main focus for today. I'm pleased to introduce our Senior Program Officer, Allison Sutter, who will take you through the details of the RFP. Allison.
All right. Hi, everyone. Thanks so much for being here today to learn more about our new RFP, Community-Driven Responses to Opioid Use Disorder and Overdose Mortality. This is an RFP for capacity building grants. I'm Allison. I'm the Senior Program Officer here at FOR. So as Karen mentioned, we launched our community-based organizations program in 2023 with 22 grants to local organizations around the US. You can see the cohort of grantees here. This represents a range of organizations, including recovery community organizations, harm reduction and outreach programs, local healthcare providers, and family services. And these organizations use the grants for a range of activities, including increasing their capacity to provide peer services and clinical services, developing community education campaigns and trainings, and developing their accounting systems, data management systems, program evaluation capacity to support longer-term sustainability. So we're very excited to open up this second call for CBO proposals. This RFP focuses on continuing to support CBO capacity to address opioid use disorder and overdose through organizational strengthening, program development, and community partnerships. This call is really targeted at proposals that will lead to increased long-term program capacity and sustainability. The request can be for up to $75,000 a year for up to 2 years. So that's $150,000 total over the course of 2 years. Some key dates that I'll highlight again later. So we opened up this RFP last week, and concept notes are due by the deadline for concept notes is July 2nd. We will review every single concept note that we get in, and we will invite a subset of organizations to submit a full proposal, and those will be due on September 15th. We anticipate awarding grants starting towards the end of this year and through early 2026. So the broad goal of this RFP is for activities or projects that will strengthen your organization's operations, leadership, technology, and programming to address OUD and overdose in your local communities. This is really intended to be flexible funding, so for you to think about what you're already doing that has a positive impact in your communities and what you need more of to scale up those services and set yourself up for long-term success. But a few examples of activities that would make for strong proposals would include enhancing operational effectiveness, so increasing your administrative capacity, maybe doing a review of internal policies and procedures to help make your organization eligible to access new funding sources. So developing a new database to do data management, improving your accounting systems. You could also propose strengthening your communication capabilities through local educational campaigns and training opportunities to make community members more aware of OUD and overdose prevention resources, and address stigma in your communities. We would also be interested to see proposals that strengthen your programming and enhance program evaluation. So hiring community health workers, peer staff, outreach staff, and evaluating the impact of that programming in your communities. We also highly encourage fostering collaborations. So that could look like developing new partnerships, maybe to embed community workers in new settings, and really build up the local continuum of care in your communities. So again, this is flexible funding, but competitive applications will show how this funding, how these capacity building projects result in long-lasting improvements in access to OUD and overdose prevention, increased access to treatment, harm reduction, recovery services, and increased capacity in your communities. On to eligibility. So this funding opportunity is limited to community-based organizations. So organizations that have a specific local reach, are providing direct services in communities and are responsive to specific community needs. We also ask that organizations have been in operation for at least 2 years and have an annual organization operating budget between $150,000 and $7 million per year. Applicant organizations must be a 501c3 or a nonprofit with a 501c3 fiscal sponsor or a local or tribal government unit. Because we really want this RFP to be focused on local community-rooted organizations, larger institutions, academic institutions, healthcare systems, and national organizations are not eligible for this particular funding opportunity, but we encourage you to keep an eye out for future opportunities that don't have the same eligibility criteria. Those other types of entities can partner with a local CBO, but the CBO must be the lead applicant on the project and be the project lead and be the one directly using the majority of the funds. You can visit our website to learn a bit more about our grant guidelines and eligibility, and also direct inquiries that aren't answered there to info@4foundation.org. So to explain the application process a bit, this is a 2-stage application process. It starts with a concept note, which is the opportunity that's open right now and goes through July 2nd. The concept note is a short, structured description of your organization's mission, how you would use the capacity building funds, and what outcomes you would expect at the end of a 2-year grant. We want these to be as low burden in terms of grant writing capacity as possible, and an opportunity for you to outline the general idea for your project. We as a team review every single concept note carefully and invite a subset of organizations to submit a full proposal. And so that has a more detailed description of the work that you're proposing, the goals, timeline, objectives, outcomes. The full proposal includes a line item budget and some organizational eligibility documents, and a description of how your organization will be better positioned after a 2-year for capacity building grant. So again, to highlight these key dates, we will be accepting concept notes through July 2nd. And then by August 15th, we will let organizations know if they're invited to submit a full proposal, and those full proposals will be due on September 15th. And all this information is on our website and in the RFP documents. And just some friendly reminders to try to make your application process go as smoothly as possible. Please check our website for the eligibility requirements. Please read the RFP document that has more specifics about this particular funding opportunity. Please think about a project that fits the budget guidelines of this RFP and the timeline, and also be clear in articulating the goals and outcomes of your capacity building work. We do expect a high volume of interest in this funding opportunity, so we cannot respond to individual inquiries for or requests for feedback on your proposal ideas. But if you have an idea, if your organization is eligible, we encourage you to submit a concept note. So we want to spend the majority of this time answering questions. Please use the Q&A function rather than the chat. And also take a look if someone has asked a question that is similar to yours, please use that thumbs up button to upvote, and we will try to prioritize questions that that many people have in common.
Great, questions at time.
We will leave the questions here.
Can they put me back on the? So who's controlling the screen? Are they seeing both? You're both being seen, right? Oh, but not there. Just like this.
All right.
So are they?
Olivia just needs to take down the slides.
They're using some new technology. This is no.
All right, there we go.
Better?
Thanks for your patience with our tech.
Okay, so thank you. We're getting lots of questions in, and as I said, we will try to get through as many as we can. But I also remind you, if you have a question that is very, very specific to your organization, please also, if we don't get to it today, the best way to get a response is to send the question to our info@FOREFDN. And Allison or the team will be able to respond a little more specifically to the situation you're asking about. But we will try to go through as many as we can today. There's a question from many of you about the eligibility of the organizations. We are including local government agencies and along with tribal agencies within the eligibility criteria. So I think there are a few versions of that question throughout the list.
So the first question. So I see an inquiry about, is there a place to find a list of previously funded projects and their summaries? So yes, all of FOR's grants are listed on our website with brief project descriptions and links to the organizations. So you can go to our website, go to our list of grantees and search by the community-based organization program to find our past 22 CBO grantees.
Okay. Can funding go towards salaries or hiring of new staff positions? That is allowed as part of thinking about capacity building, again, as long as you're tying it to the outcomes that you're trying to reach in terms of expanding the services you're providing in your community.
All right. I see a question about the desired formatting for the concept note. So if you follow the link to our grantee portal, you'll be able to set up a profile and see the concept note questions. We're looking for these to be short. There's pretty short word requirements or word limitations that we ask you to follow. And so there are questions about your organization's mission, your impact in community, and we realize that space is short in the concept note, but wherever you can include metrics about the number of community members you reach or other numbers that demonstrate your impact, that's very helpful for us to see. The other questions are about the strategy, how you would use the capacity building funds, and also the anticipated impact of the capacity building work, both in terms of your organization's long-term sustainability and organization's capacity, and also the impact in community.
Thanks. If our nonprofit has a larger operating budget than 7 million, but if you have a separate corporation as part of the agency with a lower budget, is that eligible? And yes, we will accept and review that as eligible if you have if you can clearly define a section or a separate entity within your organization that that falls within all the eligibility guidelines for this particular RFP.
I see a few questions about whether this is a reimbursable grant or a lump sum. So for pays out our grants in installments. So we make a series of payments over the course of the grant. We do issue an initial payment upfront, and then if these are 2-year grants, then it would be installments every 6 months, contingent on completion of anticipated milestones. We also have regular check-ins over the period of over the course of the grant, where every 6 months we ask that you meet with 4 staff, give a bit of a presentation on your project activities to date. And we also every 6 months ask for a narrative and financial report. And so then the next grant payment is contingent upon completion of those periodic reporting requirements. We also have a 10% contingency payment at the end of the grant, pending completion of all project deliverables.
Okay, there's a question about submitting more than one concept note. Our preference would really be for you to select the work that you want to do under the capacity building grant that you think is the strongest and the highest priority for you, and really focus on that. We do receive such a high volume that we certainly are not going to be able to you can consider more than one proposal potentially from an organization. So we'd really encourage you. If you have 2 and you absolutely want to do it, you can do it, but we'd really encourage you to give the thought up front to which is the strongest way of approaching this particular RFP.
Right. I see a question that asks, for this opportunity, we would need to be able to identify how the work would impact only those with OUD, or can we show that the work would impact individuals with SUD, including those with OUD? So as the Foundation for Opioid Response Efforts, does ask that we fund projects that have a specific focus on opioid use disorder and opioid overdose. But we understand that project that, particularly when we're talking about community-based organizations, you're working with community members that may have a broad range of health needs. And so we do ask that there are components of your proposal that are specifically focused on opioid overdose and opioid use disorder. But if the project includes activities that would also reach a broader population, that can absolutely be part of your proposal.
Thanks. There are a few questions about federally qualified health centers. For the purpose of this specific capacity building CBO grant, we are considering the FQHCs as part of the healthcare system. We have a number of other programmatic areas and funding streams that certainly include FQHCs as part of healthcare delivery. But our focus here is really on the smaller organizations in the community that are providing the services that are typically complementary to the healthcare services. I'm sorry, just as I see it, on indirect costs, the foundation policy on indirect costs is a straight 10% on all of the direct costs.
So another question, if our work is statewide, would that qualify? So as we've said, we really want this to be an opportunity to bolster local capacity for addressing OUD and OD, so an overdose. So we are looking for projects that have a specific local focus. communities, towns, counties, if your organization does statewide work, we're open if you meet the eligibility criteria, but we're looking for projects that have a local focus.
Okay, the RFP says organizations have to be in existence for 2 years. If the nonprofit was founded more than 2 years ago, but has activities starting this year, would they be eligible to apply? So it sounds like that meets the eligibility requirements. We will, strong proposals are certainly going to be able to show some data. Some of the kind of services in terms of the volume, something about the kinds of services they've been providing, the results they're getting in the community that would lead to being ready to further expand the work. So if you have the other components, then certainly consider applying.
How many awards do you intend to make with this funding? We do not have a set number of grants that we intend to make for this round. The last round of our 2023 round of funding, we were able to support 22 community-based organizations, but we don't have an exact number for this round.
Let's see. Where are we? If we are a 501c3 evaluation organization, an evaluation organization, would we be able to partner? Whoops, I just lost the question. I think it's would we be able to partner with another CBO? What we're looking for is that the CBO would be the lead, and that would mean that given that these are grants to build the capacity of those organizations to do to further do work in their community, where we would be looking for the budget to reflect that the CBO is getting the majority of the funds. If the CBO wants to contract for some evaluation services or other types of services that will help shore up their ability to provide further services, to position themselves better to get other funding in the future, then that's acceptable.
I see a question asking if a scoring rubric will be available for review, and will priority be placed on expanding services or making services more efficient and sustainable. So we won't be sharing a particular scoring rubric for the concept notes, but we do review every single one that comes in as a team, and will priority be placed on. So the priority of this RFP is increasing capacity in communities, and yes, looking at long-term sustainability. In terms of thinking about it, I would say, what are you already doing in your community that's having a positive impact, and what resources do you need to do more of it and help sustain it? So that could look like expanding services to reach more community members, or making services more efficient through streamlining administrative or operational processes. This is really meant to be a flexible RFP for you to think about what are your local community needs, what are your organizational needs, and what would help you be more successful in the long term.
Okay. There's a question about, can funds be utilized to support a recovery community, a new recovery community center? We certainly have a number of recovery community organizations as part of our first cohort. So would encourage applications from RCOs, from recovery community centers. The idea here is that you have something that has gotten started, and that this capacity building funding can allow you to again further develop the organization operationally or administratively, as well as in expanding the services you provide in your community.
Someone's asked, are incentives allowed for projects? Yes, participant incentives are a potential allowable cost for budgets. We would want to hear the rationale, and again, how those incentives would contribute to increased access to services, long-term sustainability, how they would contribute to the capacity of your program to reach community members, but incentives are an potentially allowable cost.
There's a question about whether this capacity building opportunity runs annually. We launched the capacity building program in 2023, so these are 2-year grants. We wouldn't anticipate being able to consider doing a third round of these grant funding in this program until the second round was close to finish. So we would hope that we'd be able to do this again in another 2 years, but we can't make a firm commitment on that at this point.
I saw a question about whether if our interest is across the United States or in particular priority populations. FOR's scope is the entire United States, and so we don't have a particular priority geography other than community-based organizations for this opportunity. We are highly invested in supporting communities and populations that have been disproportionately impacted by the opioid and overdose crisis. And so demonstrating how your proposal and how your organization is reaching communities that have been and community members that have been most impacted will be a component that strengthens your application. That can be described both in the strategy and also in the statement of need, telling us a bit about, what the particular needs in your local area are.
Thanks, Allison. So a question about having audited financial statements if you're at the stage where you're submitting a full proposal. And we do know that for some, particularly for some smaller organizations, for some CBOs, having audited financial statements might not be possible. It is our strong preference if you have audited financials that we do need some financial documentation as part of our due diligence. But if you do not have audited statements, there are other types of financial documents that we can have you submit that will also satisfy that requirement.
I see I think we've had a few questions about this, but do public health departments qualify? So local government units are eligible under our funding guidelines, but we really are prioritizing community-based organizations, local nonprofits in this RFP.
You mentioned that areas may be supported with these different areas that could be supported. Do we have to pick one, or can you submit a proposal that encompasses several project areas? Good question. I think particularly these are flexible funds. And so you can certainly submit a proposal that has multiple components to it in terms of how you think you could best use these funds to meet your overall objectives in terms of delivering services.
As a majority volunteer run organization, would creating a paid staffing plan be part of capacity building? Yes, absolutely. Beginning to pay new staff, adding in new paid staff opportunities. Personnel costs are an allowable expense in these grants. Additionally, funding staff time to develop a sustainability plan and think about long-term budget planning to support those paid staff would be an allowable activity. I think if an organization was applying and looking to significantly increase its paid staffing capacity, we would want to be hearing about, again, the long-term sustainability for supporting those staff. These are time-bound 2-year grants, so we would want to know what the plan after the end of those 2 years is to sustain those staff positions.
Right. Let's see. I guess a related question is, can funding under a strengthening and evaluating program be used to pay existing staff, not just new staff? Yes, again, if just tying it with what the work is and how that work would further enhance your ability to expand the services and the impact that you're having in your community.
You mentioned areas that may be supported with these funds. Do we have to pick one area like program evaluation? Or can we submit a proposal that encompasses several projects across various areas listed? Oh, did you get that one?
That's
So
all right.
sorry, it's still on my screen.
Right.
Thank you.
I'll just, there's a question about, thank you for asking. In terms of clarification, the 150,000 is the total budget that's available. That does include the 10% of the indirect. Okay. Given that these are flexible funds, to me, the indirect and the use of the other funds is a little bit more fluid than on some of our other programmatic grants. Let's see. It's still 96, so there must be somebody having enough. High risk. Okay,
Can you please restate the populations that you defined as high risk? So some of FOR's priority populations include justice involved populations, populations that are aging, people that have been disproportionately impacted by opioid use and overdose in the United States. And but that also depends on your community. So thinking about who in your community is currently not able to access services, and make the case for what the local needs is. So there isn't necessarily, with these flexible funds, there isn't just one definition of high risk population. It really is dependent on who is most impacted in your local area.
Yeah, I mean, I think the starting point for us is always looking at the data, the most recent data in terms of overdose mortality, and and which populations, both from national data as well as studies, we know are at particularly high risk of overdose. But as Allison said, that can also vary by community. So having some information and data that you include in your concept later on in terms of what's happening in your community is really helpful.
Can substance use coalitions apply for FOR funding? So if the coalition meets the eligibility criteria, budget, 501c3 status, or fiscal sponsor, you are eligible to apply. But again, these projects should have a specific local focus. So a national coalition doing sort of with a proposal that has a national scope is not the emphasis of this RFP. This is for work that has a specific local geographic area.
Question about, is research permitted under the RFP? Again, these are to build the capacity operationally, administratively, programmatically of the organization. If there's a component of collecting data, assessing data about the work of the organization that helps you further the overall mission. So in that sense, research in that sense would be considered eligible. If it's entirely to do a research project of interest that sounds like it may not fit within the real objectives of this RFP. Oh. Are previous grantees awardees eligible for this round as well? No, this round is to expand our CBO capacity building program. So we're going to be looking to add new grantees to that program. And I know Allison answered a question earlier about a rubric or a scoring rubric. What we can say about that is that when we look at the concept notes, we are really seeing how well the concept aligns with the content that we have put in the RFP. So for the types of activities that are allowable in this and the types of organizations. I think reading carefully and tracking the RFP as you put together your concept note will be important.
So I see some questions about the budget requirement being based on overall organization budget or the program within the organization focused on opioid response efforts. And we have a few questions of this nature. So if you are an organization that has sort of several sub-programs that are very distinct in their budgeting, work, and staffing, we're open to accepting concept notes where you respond to the screening questions based on the budget of the individual program and applying as that entity. However, if you are invited then to move on to the full proposal stage, we will need to see an individual budget for the subsection of your organization that is applying for and using the funds, and we'll need to see that is sort of a distinct individual budget and that our funds will be going to that program. Again, the overall goal of this RFP is for smaller local nonprofits to take their services and build capacity and build up to the next level to sustain and expand their services. So we are looking for organizations that are within that budget criteria.
There are a couple questions about 501c3 and fiscal sponsor. If you have your 501c3 designation, then you do not need a fiscal sponsor. The fiscal sponsor is an option if you're an organization that is in the process of applying for 501c3 or just has structured your organization in a way that you're working with a fiscal sponsor instead of have your own designation. If you're somewhere, I think someone asked if they just transitioning from one to the other. If you have your 501c3, then you're eligible.
I see a question about a community-based organization who has a component of their program that's being adopted and used in other communities and states. So if your work has had impact and expanded into other geographic locations, that's fantastic. We'd love to hear about that. And if you are a local 501c3 or organization, a local nonprofit, then you are eligible to apply for this opportunity. But we do want the programming that we're supporting through these proposals to be locally based as opposed to multi-state impact.
The concept note is, we try to keep those pretty brief to not be burdensome. It should come out to, it's about 8 questions. It should come out to a couple of pages. I don't know that we have a word count handy on that, but if you look at our website, you can see the questions, yeah, and what the word count is. Okay. Purchase of capital assets as an allowable expense. Again, we're not looking for a grant request that would be entirely to purchase capital assets. If a component of the budget is to purchase something that's required to be able to again advance the overall work and mission, then we're willing to consider that. So as a part of the budget, we're willing to consider it.
I see a question about programs that are not yet offered, but that CBOs are trying to get off the ground in the next 2 years. So proposing new work, new programming is absolutely allowable under this RFP. Again, we would want to hear information about the community need and some data behind why you're interested in implementing this new programming, and then also to think about the sustainability beyond the 2 years of funding.
Scrolling through to see, I know there are a lot of questions that are similar, so I think we have hit on some of these topics. And again, if you have something that is very specific that we don't touch on today, we invite you to send that in to our info@4fdn.org, and the team can work on responding if it's about eligibility.
I see a question about specific impacts and numbers around impact, and if we have targets around metrics. this funding is flexible, so there is not a set number of people that you need to reach. That's part of the RFP criteria. That would be something that you tell us what local impact looks like in your community. So that would be for you to set. We, as part of the concept note, is short and structured and really about the overall strategy of your proposal. If you were to move on to the full proposal phase, we would ask for anticipated numbers of community members reached, services provided, but that is something that's going to be dependent on your local need as opposed to a target that we're putting out and asking you to reach.
Does the increase in capacity that we hope to expand by need to be realized at the end of the grant period? If we, in other words, if we expand our reach to accommodate up to 100 new patients, do we need to actually gain 100 new patients? We do ask for milestones, for goals and milestones that would be achieved during the 2-year grant period. There was I'm gonna ask the team, maybe Ken or Lydia, to just put in the chat as well, the info@ford.fdn.org, and see some other people asking for that.
I'm also seeing a handful of questions about the $150,000 budget minimum. And so that we do want to be looking at with this proposal organizations that are providing services in community and have been in operation for at least 2 years and are as opposed to being in the startup phase and are in the phase of leveling up their services and being sustainable in the long term, again through activities like bolstering internal processes, developing data management systems to make you eligible for other funding opportunities. So that $150,000 per year budget minimum is tied to that and trying to target organizations that are in a growth phase. And also because this funding is about long-term sustainability, sort of understanding how the grant amount ties into your overall budget.
Yeah. I'm going to take the next couple that I see here. There's a value of that share the value of the average award provided during the last cycle. Just about all of the grantee, all of the grants in the last cycle were at the maximum amount that we had available for this funding opportunity, which is the same as this time. So they were essentially all $150,000 over 2 years. Is there a specific numeric impact that is most compelling to the foundation? For example, if we work in a small rural community, we may impact less people. Would that make this less compelling? No, we have, it's really important to us that we are reaching and connecting with organizations in very different kinds of communities. We do appreciate that being in a very rural or remote area is not going to have the same numbers, although the impact you might be having on the people in your community certainly will be as compelling as in a large, for example, urban area. So just explaining to us what your area, the geography, the demographics of your area in terms of what you've done so far, what your goal is, and how you see that, how you see that impacting your community is what will make it compelling.
I've seen a few questions about directly covering healthcare services or insurance for participants. And the type of services and programming that FOR can cover under this RFP is flexible. We mentioned participant incentives, but I do want to emphasize the organizational capacity building focus of these funds. So we really want these funds to be invested in activities that will strengthen your organization and increase your capacity. So funding individual healthcare, may not be the strongest capacity building proposal because we want to be thinking about what happens at the end of those 2 years and how will your organization be able to continue and sustain those services.
Yeah, no, I think that's good. I mean, this, again, we have different funding opportunities, and different programs, but in this case, we really, are trying to provide funds that are flexible from the organization's perspective, to be able to build up your operational, your administrative, your financial. We're trying to look for things here that often are not funded by foundation grants. So thinking about some of our first cohort, we had grantees who used some of these funds for development, for a development officer or for a communications marketing plan, so that they could advertise their services more broadly and let people know in the community know what they were providing, to develop databases so that they could track who they were serving better, and then use that data to apply for even larger funding from other sources. So that gives you a sense. And again, on our website, you can look at our current cohort and get some more ideas perhaps from there on ways in which we've seen now over the last 2 years, these grant dollars really be used very effectively. With the focus on overdose prevention, does this include primary prevention? It does. When we talk about OUD and overdose, we are looking at and hoping to have a cohort that is collectively working across the whole continuum, primary prevention, harm reduction, treatment, recovery.
I see a couple questions about the grantee portal, so just want to emphasize that all of the links are on our website. Our grants portal is called Giving Data, so if you click on the Apply for a Grants link, you'll be prompted to set up an account there, and you'll be able to access the concept note form. If you're having technical issues, you can email info@forfoundation.org for inquiries. And I see we just dropped a link to the grants portal in the chat.
Okay. Back to the end and see if there's something we haven't covered at all. And there's a question at the end about letters of support for in the full application. Yes, there is an opportunity to include letters of support. And certainly if you are applying with any partners in the project, then we require a letter from that partner that acknowledges that they are part of the team. Our first round had 22 grantees in it.
And again, like this opportunity, those grants were for up to $150,000 over the course of 2 years.
Mm-hmm. And must the grant funds be used within the 2-year period? Yes, when you submit a full proposal to us, you're submitting a budget for a 2-year grant period, and then the milestones in the project are aligned with that 2-year period.
I see a question about a preference for projects with partnerships. One of the gaps in this area that FOR has recognized and continuously tried to address is the siloing of different areas of support for people impacted by substance use and overdose. And so we highly encourage local programming that contributes to a continuum of care, reaches people with a range of services across the spectrum of recovery services, harm reduction services, treatment services. And so if forming local partnerships is going to strengthen that continuum of care in your community, then that's highly encouraged, but it's not a requirement for the proposal.
And again, depending on the way in which you feel you need to strengthen the capacity of your organization, this may be one this might be one program where the kinds of uses for the funds are a little bit, the e-proposer can be a little bit different. So if it's not so much focused on the partnership because you know you really need to strengthen your financial and your HR capacity, then that's also okay. There are a couple of questions I just want to get to before we end, is whether or not our funds are backed by federal funds. We are not. We are a private foundation. So that is not, there's not a tie to or worry about in that respect, at least our fund, anything happening at the federal level that would directly impact the funds. And I think we can do maybe one or two more quickly. Get me right to the end. If there's something we haven't touched on. Okay, if there are questions about the grantee portal, did you respond to that?
Yes, I answered the grantee portal again. You can reach out. There's a link in the chat to our grantee portal, and you can also email info@forfoundation.org with general questions.
Okay.
I've seen a couple questions about individual proposals, and we are not able to answer individual inquiries about project ideas as while the RFP is open. We're expecting a high volume of interest, and out of fairness, we're not able to address all of those individually. General questions, eligibility questions can come to our info email address.
Right. But again, we certainly encourage everyone, if you think you have an idea that fits, we try to make the concept note stage pretty low burden and encourage you sending in your ideas. The mandate for our foundation is to focus on reducing opioid related harms and the impact of the opioid crisis and overdoses. So as long as that is at least a core component or the main component of the work, your overall work can be broader in terms of SUD and still be eligible. Yes. Okay. And then just one more, because again, a number of questions seem relate to an organization that might have multiple locations or be multi-state or national. Can we really use these funds to build up resources and supports within a specific local community? So I'd encourage you to think about, again, identifying a particular one of your local projects or organizations that would be best suited at this time to apply for this opportunity. I think we can do one more and then we'll wrap up. If there's anything that we haven't. Olivia, anything else?
And also a friendly reminder that we will be posting a recording of the webinar and the slides shortly after the event ends. And there's more information about the RFP and more details about this funding opportunity on our website. So please use all of those resources.
Okay. All right. We're just coming to the top of the hour. We really appreciate everyone's interest. I think we've gotten over 150, 160 questions. We really look forward to getting your concept notes, to hearing about the work you're doing, to hearing about your ideas and ways to expand the work. Honestly, we learn a lot from these processes, as well as hopefully able to identify some amazing work around the country that we're able to help support. So we'll look forward to your submissions over the next 4 weeks or so, between now and July 2nd. Thank you again for joining us today, Allison.
Yeah, thank you all for being here. We are reachable at info@forfoundation.org. So again, please feel free to direct general questions there. And thank you so much for your time today and for all the work that you're all doing in your communities.
Thank you.